You had to get that in there, didn't you, Raul? All right, it's one of the prettiest parts of a woman's body, but it can also be one of the most neglected. We're talking about the area from like right here to right here. Joining us this morning is board-certified dermatologist Dr. Melanie Palm of The Art of Skin, and we're talking about ways that we can fix some of the things we're self-conscious about on our chest, basically. So what are some of the reasons that we get the chest wrinkles, the pigmentation, these issues that a lot of people really worry about and make women want to cover up, frankly?
Yeah, I tell women a lot of times we take really good care of our face, but we neglect our neck,
Yes.
our chest, and our hands, and that gives away our age. So a lot of it's UV exposure, a lot of it's skin thinning, and we start to lose the collagen matrix, what gives us suppleness to that area. So that contributes to some of the wrinkling in that area.
Very good, and we're going to try some of these out on Stacy. Stacy, what worries you about your chest? What don't you like?
Again, it's I have a lot with the sleep wrinkles, so it's crepey and wrinkly, so I like to get that filled out.
Absolutely. You're not alone. A lot of women are that same way. Let's talk about some of the options. First, we've got the IPL laser. Tell me about this.
So IPL is a broadband source of light, and it's used to treat pigmentation. And so I think we have a before and after, but it's really great face, neck, and chest to be able to use to remove brown spots. And then sometimes we combine an IPL with something called photodynamic therapy. So when people actually get precancerous spots that are on the chest or on the face, we combine an IPL with a photosensitizer, a solution beforehand, and you get a more augmented result, better clearance of the pigmentation, but also clear a lot of the precancerous lesions as well.
Gotcha, and we saw some of those pictures right there. Talk about that photodynamic laser, how that works and what that does.
Sure, so the patient's usually at our office a couple of hours. We put on a solution, doesn't hurt at all, and it soaks into the skin, but preferentially goes after precancerous spots, pigmented spots, even a little bit of blood vessels. So this was actually a young mom that was sort of upset. She lived in the OC, was sort of getting a lot of sun damage with our kiddos, and we were able to clean that up within a couple of hours. We pink for a little while, scale for about a week, but as you can see, the skin is quite rejuvenated afterwards.
Right, absolutely. Okay, another option is the, help me with this, the sclerotherapy?
Sclerotherapy, so very good. So that's injection therapy for veins. So most commonly we use it for like spider veins of the legs. It's great for the chest. So I think we have a before and after of a woman that had reticular veins, sort of the greenish blue veins in our chest, but also these little spider veins. So we combined IPL, that broadband source of light, with injection sclerotherapy to remove those veins and clear up her chest.
And you can definitely see results on those pictures right there. How long are you going to expect to see those results before you need to go get treatment done again?
Sure. Well, sclerotherapy is done as a series of treatments. In her case, I think she had 3, and that should be, you know, a permanent result. People can get a little bit more in terms of vein growth, but what she has should be sustained.
And what are we looking at as far as cost goes?
It's not too bad. It ranges depending on the area in the chest. If it's just a small area, it can range anywhere between $250 to $500 per treatment.
All right, lastly, let's talk about another option, Sculptra.
Yes, so we're actually going to do that over the break. Sculptra is a collagen builder, so it's most commonly used in the face to build volume, but we can also use it on the décolletage area to build that collagen matrix up again, and that's what helps with those stubborn little wrinkles from sleep and from sun exposure.
And you have a little laser demo to do before we go on the break for us.
So this is a device. This is the INFINI device. It's radio frequency, the same platform of which Thermage is based off of. So this combines microneedling with this radio frequency, which is a special form of electricity to produce heat and build collagen. So it's really good complement to something like Sculptra.
Okay.
So we're just going to demo a couple of little spots, but it's a quick treatment.
Stacy, have you had this done before?
I have.
You have.
I have.
Okay. And you've been happy with it?
Absolutely. I love it.
And so we'll just, you know, we start over the whole area, but we'll do a couple of pulses in this area, and it just kind of works like that.
Just like you're hole punching or something, huh? And you just do it right over the affected area just one time?
You do it usually several passes, so we can adjust the depth of the needle. We usually start deeper. We can go as far as 3 millimeters, which really is getting down into that skin where we need to affect it, as superficial as just a ½ millimeter.
How did it feel, Stacy?
It's great. She's so good about numbing. She's very into having her patients comfortable. So.
Okay, that's really cool. Next, we're gonna do the Sculptra. We're gonna actually do that during the break. So real quickly, just tell us what you're gonna do during the break.
So we're going to use it in this V-shaped pattern. As you can see, you know, and Stacy, if you move, she's kind of bothered when she wakes up. She's getting these little vertical lines, and so we're going to concentrate in this V area, use a little injection technique just with some local numbing that we've used, and fill that with the Sculptra, and over the next several weeks weeks. That's going to start to build the collagen in that area, but you'll see a little bit of an immediate fill right now.
Interesting. Right after the break. Okay, cool. So don't go anywhere because we're going to be injecting during the break, Stacy, with the Sculptra, and right on the other side of the break, we're going to show you the immediate results. So don't go anywhere.